Today I'll be addressing how flu spreads quickest among kids, teachers, and healthcare workers, and how it relates to the assessing of health needs of the community in Chapter 9 of our text. A recent survey was conducted June 26, 2013, with a sample data of 5,000 people. Teachers, children, and healthcare workers were studied because they have lots of social contact with other people on a daily basis. Stopping infectious disease is the primary role at any well-managed healthcare organization, HTO. Social contacts are defined as face-to-face conversations within 6.5 feet or skin-to-skin physical touch. Common practice in any business, especially HTOs, is to frequently wash your hands on a regular basis. Back in 2012, I worked at a healthcare organization in Japan, and we had to use hand sanitizer in front of the patient just before we examined them. So the patients knew that our hands were clean. It didn't matter if we just washed our hands. If the patient didn't witness it, it didn't happen. That's an extra measure healthcare organizations can use to cover their backside. Community health success is ultimately measured on population-based indicators such as immunization tests, rates of preventable diseases and premature death, and measures of life expectancy adjusted for the ability to lead a normal life. Education professionals already knew that professionals had made high possibilities of infectious disease, but they didn't have quantitative numbers to back up their hypothesis until now. Before this, professionals didn't have the numbers to back up their conclusions. By quantifying those social interactions, we can better predict the risk of contracting, and spreading infection, and ultimately better target epidemic control measures in case of pandemic flu, for example, he explained. Now, of course, the highest number of social contacts were kids because they had contact with each other in the bus, classroom, recess, and in the neighborhoods. The level of prevention is often key to the cost effectiveness of a specific action and an important factor in prioritizing opportunities. Common sense tells a professional that older students, unemployed, and retirees had the lowest level of social contacts. Older students like me prefer to take online courses which limit their social contact. Unemployed people aren't in the workforce, thus limiting their social contact. Retirees are busy with their gardens and grandkids, thus limiting their social exposure. For example, teachers see an average of 62 people during the day, while retirees see 19 people a day, according to the study published June 27th in the Journal of the Royal Society. An average person will have 26 contacts per day, compared to children, which have 47 contacts per day, 33 contacts per day for a healthcare worker, 32 contacts a day for teachers, and 19 contacts per day for retirees. Now, I would like to believe that I'm relatively safe because I'm an older student that's partially retired, but hopefully that will change once I receive my degree from Webster University. Okay, in conclusion, this study isn't to deter you from pursuing your healthcare career, but merely telling you to protect yourself and your kids from infectious disease because children in healthcare are the race of those studied. Was this study helpful to you, or did you already know the results before the data was presented? Thank you very much.